Gauteng, as Michael mentioned, seeing a surge in the number of active COVID-19 cases. The province has surpassed the Western Cape in active cases now. The Health Department says this was expected, but it is, of course, still very alarming. I'm joined now by Gauteng Health MEC, Dr. Bandile Masuku. Good evening, Doctor. Thank you so much for your time. Looking at today's stats, over 36,000 cases in Gauteng, 9,000 odd recoveries. So we're looking, am I correct, at about 27,000 active cases in the province. Is that correct?
Yes, it is correct, and those are the figures that we are actually looking at, and we are quite concerned about the increase, but there is some form of a silver lining on the cloud, because the majority of the active cases most of them have not required any form of hospitalization at the moment.
All right, so let's look at hospitalization. How many hospitals are battling with intake? How many people do we have in hospital with COVID-19 or suspected COVID-19 in Gauteng at the moment?
Yes, I think it's true that you have to separate the two, because there are those who are suspected COVID, we categorize them as patients under investigations, which are almost 355 in our facilities, and only 36 are in ICU as that category of PUIs. And then we've got 2,376 patients overall who are confirmed COVID positive cases, and we almost have above 120 who are on a vent in this current moment. So these are the figures that we have, and it's still a relatively low number of people that are in hospitals if you compare it with the people who are confirmed actually positive.
Sorry, just I missed, you said 2,000, what was that figure for COVID patients in hospital?
2,776
okay.
That are patients that are in hospital who are admitted as COVID positive patients.
All right. So I just want to draw to your attention some predictions that were given to our team a little earlier today from some of their sources. They've been told in Gauteng we could see 50,000 general admissions by mid-September, and 5,000 to 7,000 people in ICU by mid-September. I have to ask you, is this plausible or is it panic-mongering?
No, it will be difficult to say and describe it, but it's something that we are managing in terms of our own understanding. Usually when we talk about the numbers of people who require hospitalization, we talk about them in a period of 3 to 6 months, not only on one day. And since we have started, like we've said, that we're approaching 100 days of lockdown, and also, in terms of what we have been doing, you see that in Gauteng we still have a very low rate of hospitalization, which is something that I think we should continue to have, and maybe our clinicians have to look at it and see how is it possible that we don't have at equal. When Western Cape was at the same level with us, they had more death and more hospitalization, and it's something that is quite unique with Gauteng as we speak of now. But there are several factors that can be attributed to that.
Yes, and there has been the alarm bell sounded by people such as Professor Shabir Mahdi, who said he's extremely concerned at how quickly the cases have increased in Gauteng, and we have incredible population density, which if everyone starts getting sick at the same time, as you say, it's not obviously at a critical stage yet, we could be in for some very serious problems, particularly if we reach our peak earlier than expected. Now, we were hoping or thinking peak would be about August. If we reach our peak earlier, which is something Professor Mahdi is saying could happen, we're losing out on time that I know your department is hoping to set up more facilities. Am I correct?
Yes, I think the work has already started in many actually of our facilities, except that we are hoping that the modelling will be quite kind to us, that we get to the peak at the time where it's expected. And it's something that we need to look at in that regard. And we are concerned that this is actually coming up quite early.
Yeah, so that is potentially very worrying. So I have to ask, it feels as if we are opening up our economy at exactly the wrong time. I know that opening up the economy does increase the infections, but When it comes to Johannesburg, shouldn't we perhaps be considering locking down just for 1 month to get us through the next 3 to 4 weeks, which we have been told are going to be critical? Is it even an option on the table, or is our economy under so much pressure it is simply nowhere near discussion point?
It will require us to have a delicate balance, a balancing act between the two, between the livelihoods and also the lives of our people. And I trust that in our discussions and engagement which we are having internally, it is one of the options that we are having in terms of going back to hard lockdown, or even have some other options. The World Health Organization had given Pakistan an option of intermittent lockdown, which we are also seeing as part of our discussion. But it's not something that is totally off the table. But we want to have something that government can do. I think government we cannot throw our hands in the air and say we are giving up. We still have to apply what is within our powers to limit and reduce the rate of transmission and disrupt the pattern of the infections.
On Friday, there was concern about Tembisa Hospital. Some reports that there were patients sitting in corridors, that the hospital was under severe pressure already. I was wondering if you could confirm if any of the hospitals are under COVID pressure or not.
They are, because of the nature of the season that we are in. That is, without COVID itself, we do see a number of patients that come in with normal bacterial pneumonia and others. So our emergency and accident departments have been quite pressed in this regard, particularly with patients that we have categorized as PUIs who are awaiting results to be triaged to proper wards where they will be managed, whether as COVID positive or as just normal pneumonias.
All right. Well, thank you very much for your time this evening, and good luck for the weeks ahead. That's Gauteng Health MEC, Dr. Bandile Masuku, telling us that there are 2,776 confirmed COVID patients in Gauteng hospitals this evening, 120 of them on ventilators tonight.